Let's now move on. And the United Nations Children's Fund, UNICEF, is today marking 75 years of providing humanitarian and developmental aid to children worldwide. The UN Humanitarian Agency has a presence in 192 countries and territories, including Ghana. Out of its 75 years of promoting the welfare of children across the globe, UNICEF has spent almost 40 years in Ghana advocating better healthcare, education and sanitation-related issues. In healthcare delivery, for instance, it has provided various logistical and technical support for neonatal care services to reduce infant mortality at the district and regional levels. The promotion of kangaroo mother care, also known as KMC, at various district hospitals has been key in reducing child mortality. UNICEF Health Specialist Priscilla Wabil, on a tour to beneficiary district hospitals in the northern region in 2019, threw more light on how much impact the program has made on Ghana's healthcare delivery.
Care is a very simple program. We call it a program, and it encompasses skin-to-skin contact between the mother and the baby, and then for prolonged hours, especially for the small babies, because they are not able to regulate their body temperature. And then also the second part is the feeding aspect, where they have access to the breast. They are in between the mother's breast, and also comes with, you know, when you look at the boxes down there, there are some special small cups, graduated cups, feeding cups, where mothers would express the breast milk and then feed the babies, because some of them have difficulty in attaching to the breast and suckling at the breast. So we have these cups that mother would express and be able to feed the baby by cup. And then as the baby matures and develops, the baby will now be able to attach to the breast and suckle well. Then the last component is the follow-up care, because once they are small, they were born small before their time, they need to come regularly for follow-up, and then the nurses will continue to monitor them. And we have seen remarkable improvement in their survival. They gain weight faster, they have less infections because you have fewer people touching them, because once they are tied in between the mother's breast, you have fewer people wanting to carry the baby, fewer infections. And the other thing is that whilst they are in skin-to-skin contact with their mothers, the movement of the mother, the breathing of the mother, the heartbeat of the mother stimulates the baby to continue to breathe, because when they are small, they sometimes forget to breathe and they stop breathing and they can just die. But that posture of being with the mother, and the heartbeats, someone said, it's like a song in the baby's ears. And the baby is stimulated to continuously breathe. And the mother keeps rubbing the baby. And the baby bonds very well. So that's nurturing care. When we talk about early childhood development, that's how it starts. The nurturing care, bonding with the baby, feeding. So that all helps to improve the survival of these babies. They gain weight better, they are protected, and then...
Now, in the area of education, the agency has been keen on retaining adolescent girls, especially in school. It has thus identified the provision of wash facilities in all schools to make school-going attractive and more exciting for the girl child. Regional Director for West and Central Africa of UNICEF, Marie-Pierre Poirier, told Joy News in 2019 Ghana had so far done well in that regard. They are, however, collaborating with government to improve the situation.
We are looking with the government at what could be done about this, very innovative ideas. First of all, particularly for the girls, you were mentioning child marriage and girls dropping out. A simple thing, sanitation facilities. If you don't have a sanitation facility in the school, particularly for the girls in specific moments of the month, how embarrassing. Maybe they would like to go home and then they don't come back. Sanitation facilities separated for girls and boys will do a long way to make sure that the kids stay there. The ambiance in the school, the safety in the school, and Ghana is a member of the Safe School Initiative.
Well, joining us on the back of that via Zoom is the Chief of Communications at UNICEF Ghana, Yolette Ewart, for a conversation on this milestone. Yolette, a warm welcome to Joy News and congratulations to you and your team across the globe.
Thank you very much and good morning to you as well, Benjamin.
Great. So tell me, 75 years globally and 40 years in Ghana, how does that make you feel?
Yeah, it's great. I mean, UNICEF is extremely excited about today. We're thoughtful as well. Certainly, over the last 75 years, UNICEF has achieved a lot. You've already outlined many of the areas in which we worked here in Ghana. We've been in Ghana since 1982. We've achieved a lot to help to transform the lives of children by ensuring that we're respecting and promoting their rights and well-being. But we realise that the job is not done. There are still many challenges that face children, adolescents and young people, not just in Ghana, but around the world. Many of them are shared challenges. And so the strength of UNICEF is that it works at the global level and also nationally in order to be able to apply its levels of expertise, experience of working in country as well, and working, of course, with key partners in order to help to improve the lives of children. And that's what we aim to continue to do in whatever circumstances.
Right, and this is certainly worth celebrating, but what exactly in the 75 years stands out for you in terms of impact?
Sure, okay. Well, I'll speak very much for Ghana. Ghana can celebrate many firsts, actually, and UNICEF is happy to have been part of that. So, as mentioned before, UNICEF opened its doors here in Ghana in 1982. About 8 years on from that, Ghana became the first country in the world to ratify the Convention on the Rights of the Child. This is a convention, as our regional director said, this is a convention which is the world's most ratified convention. It seeks to protect and respect the rights of every child, and Ghana led the way for the rest of the world. Following that, just this year, Ghana was the first country in the world to receive the COVID-19 vaccine through the COVAX facility, and UNICEF played a significant role in that also in providing the supply and logistics of the vaccine and enabling Ghana to receive that. We've been working very closely with the government to seek to strengthen the health systems, seeking to ensure that the right equipment is put in place to ensure that we can receive such vaccines, helping with regard to communication and community engagement in that area. But COVID is not the only area in which we've been working in recent years. We can also speak to the fact that with the support of UNICEF and other partners, many girls now are less at risk of anemia. Anemia was a real challenge for teenage girls aged between, adolescents really, between 10 and 19. This has really impacted their schooling as well because they're not able to concentrate very well at school as a result of anemia. So working with the government a few years ago, UNICEF supported the establishment of the Girls' Iron Folate Tablet Supplementation, otherwise known as GIFTs. As of this year, more than 2.5 million girls are receiving GIFTs. As a result, they are now at less risk of having anemia, are able to concentrate more in schools. Right. So there are many other areas. We can talk about water, open defecation, health, protection of children as well. There are many areas in which we've really seen some successes, actually. Please allow me to just say more. Just before, I know you want to come in, just one more, in the sense that now more girls are able to access justice more easily as a result of the establishment of 10 new child-friendly gender-based violence courts. So this enables, and with thanks to Joy for covering this in previous months as well, this now enables girls, or should I say victims of violence, to be able to go to court without having to see their alleged perpetrator of the abuses. Just enabling children, going to court is very difficult anyway, so enabling girls to have the opportunity to go to be able to present their case fairly is another area in which UNICEF is happy to have supported.
Yolette, to cap off the conversation, two things I want you to quickly address. How is the commemoration going to be like here in Ghana? What form will it take? And secondly, what does the future hold for UNICEF and children in Ghana?
Okay, so the first one, this afternoon, we are aiming to have a lovely moment with various invited guests to view a photographic and art exhibition where we'll be showing some of the work achieved by UNICEF in recent years, and also illustrating some of the art which has been crafted by children as they reimagine their future. Some children will also be speaking at the event as well and sharing their view, and we'll be also premiering a film which reflects UNICEF's 75 years, and Ghana plays a key role there. In terms of moving forward, there are 4 key areas of priority across the globe for UNICEF, which will also continue to be a priority for us here in Ghana. And they include addressing the learning crisis, seeking to ensure good health for children, particularly with the focus on vaccinations and immunizations, climate, water, and also violence or mental health and well-being of children. But there are many more areas, so we're delighted to continue our work here in Ghana.
Yulette, it's been a pleasure. Thank you for joining us on Joy News Desk. Yulette Ewart, Chief of Communications with UNICEF.